So I'm just going to show you that I have worked in my own practice in a way that has not been very efficient, and how I've gone from the not very efficient way of doing orthodontics to sort of a more efficient way, which has decreased the stress on me and my practice. So this is a 13-year-old girl with a retrognathic mandible, class 2 division 1 malocclusion with significant overjet and a 90% overbite. She has proclined upper and lower incisors, and overall it's a skeletal class 2 malocclusion. And so she was treated with a crossbow appliance, so an expander, a mini expander, and some forces springs. And then that was followed, after 6 months of that, we did full fixed appliances, so braces, and some class 2 elastics. And her overall treatment time was 24 months. 17 office visits. This is her debond, and you can see some gingival inflammation because maybe the brushing and the flossing weren't the best. And this is her at her first retainer check. The gingival tissues have healed, and the result overall is quite good. And again, that took 2 years. And when we calculate how much time this patient spent in the office and we total all the clinical appointments that we did, the total clinical time was 8 hours and 20 minutes. So that's how much time I spent with her. And a similar patient, a very similar patient, a very similar class 2 division 1 malocclusion with a similar overjet and overbite. She's a similar age, quite proclined incisors, was treated with clear aligners and high frequency vibration. So I'm going to talk about Propel VPro. And she changed her aligners every 3 to 5 days. And this is her after 16 weeks. So this is 3.5 months. And this took 4 office visits. And now she's in a retention with a nighttime clear aligners, clear retainers. So to compare, so they're two very similar patients with very similar outcomes. The total clinic time for the second patient was 1 hour and 45 minutes. So you can imagine how much easier this is on the patient and how much easier it is on the office and all the systems that we have set up in the office, if a patient spends only less than 2 hours for their entire treatment.